Hello, everyone. My name is Ross Maltz. I'm a pediatric gastroenterologist, and we're going to talk about step therapy reform, what providers need to know about state step therapy reform laws. As I mentioned, I'm a pediatric gastroenterologist at Nationwide Children's Hospital in Columbus, Ohio. I'm also an assistant professor at The Ohio State University, and I'm the co-chair for the Government and Industry Affairs Committee on the National Scientific Advisory Committee for the Crohn's and Colitis Foundation. I have no conflicts of interest. So today we're going to talk about step therapy or fail first protocols, what they are. We're going to talk about state step therapy reform laws, what they are, who they help, or where can I find out more information. We're going to talk about, as a provider, how do you navigate that process for your patient, and how else you can get involved with step therapy reform. So what is step therapy protocols or fail first protocols? As you may know, the insurance company will require a patient to fail on a specific insurance recommended medicine before a patient may go on the prescribed medication by the provider. Why are step therapy protocols in place by the insurance company? Well, most of the time it's actually based on cost. Insurance company would like for patients to be tried on medications that cost less before being tried on medications that are more costly for them. What effect do step therapy protocols have? So number one, it really does interrupt that patient-provider relationship. You're sitting in the office with your patient and you're discussing the possible treatments, and you and the patient come to a conclusion what will be the best treatment for that specific patient. But then you need approval from the insurance company, and the insurance company may have a different approach and a different recommendation. So it really does interrupt that patient and provider relationship. While waiting for approval from the insurance company, you're getting delay in optimal treatment. It can result in progression of disease if there is an extended delay. And as you know, as a provider, we have to deal with the administrative burden, not just us, but also our office staff, in trying to navigate and advocate for our patients and get them on the proper therapies. So the Crohn's and Colitis Foundation in December of 2016 conducted a survey, an online survey of about approximately 2,600 IBD patients, and 40% of the patients in this survey that responded were subject to step therapy reform. 57% of these patients were required actually to fail 2 or more drugs before having access to the originally prescribed drug by their provider. And 60% were unable to have a doctor intervene to stop that step therapy process. 32% were delayed from optimal treatments for over 7 months, and 94% of the patients that filled out the survey felt that step therapy was a barrier to timely and appropriate care. So what do state step therapy reform laws do? So important to note, they do not actually eliminate step therapy, but it does require a transparent process. The process is supposed to be very easy and quick, and you're supposed to get an answer within that specific time frame that your state requires. It's supposed to go based on protocols and clinical guidelines published by providers, and it allows for an exemption to protocols when deemed medically appropriate. So when do we want to advocate for a patient that we believe that the insured provide drug is not indicated? Well, when we think it's contraindicated, or that drug that the insurance company wants our patients to go on would cause harm to them, or that drug that the insurance company wants our patients to go on we know will be ineffective for the type of their disease, or if a patient has actually already been on that medication and failed it previously, they shouldn't be required to retry it again years later because they have already failed. If it's deemed not to be the patient's best interest, it's not medically appropriate. Or additionally, if a patient is already on a medication and is stable on that medication, they shouldn't have to try a new medication just based on step therapy reform. I've had patients where the patient has changed insurance companies, and the new insurance company wants them to go through step therapy, even though they're doing really well on their current therapy for years and stable and in remission. So who do these laws cover? So state therapy reform laws only actually cover state-regulated health insurance plans. What are state-regulated health insurance plans? They're fully insured health benefit plans. They're state-based health insurance market plans. They're state employee health benefit plans, and some states actually do cover Medicaid plans, but not all states. Who do these laws not cover? So the state step therapy laws do not cover federally regulated health insurance plans. What are federally regulated health insurance plans? They're basically self-funded health benefit plans or large employer-sponsored plans, Medicare plans, TRICARE, and federally employees health benefit plans. If you're unsure if your patient health insurance plan is regulated by the state, we recommend two things. One, the patient should contact their state's Department of Insurance, or the patient can also contact their human resource department and find out if their health insurance that they're receiving is regulated by their state or their federal government. Where can I find more information as a provider? So two important links for you. You can get information on the crohnsandcolitis.org/steptherapy website, and you can also get contact information on the State Department's insurance website. As you know, navigating the exception process can be very tricky for the provider. Most importantly, we want you to sit down and discuss the process with your patient. We want you to decide with your patient which is the best treatment for your patient. And after that decision has been made, you want to submit an initial prior authorization like you normally do. But if the initial prior authorization is denied, you would then apply for exception through the insurance appeals process. Throughout this whole process, it's really important that the patient understands the insurance approval process and make sure that there's an open line of communication between your office and the patient, so the patient isn't getting frustrated waiting to hear what happened. How do you navigate the process? As a provider, you want to make sure that your office submits the necessary documents relevant to the exception that you are seeking. Laws pertaining only to state-regulated health plans. So if you're unsure if your patient's plan, we recommend continuing the process regardless. And if the health plan fails to respond with that time frame established by that state law, the exception or appeal is actually deemed granted. Internal exception appeals process. So if the health plan requests more information as a reason for denial, reapply with the necessary documentation that support your exception request. It's very important that you provide the proper documentation. You want to make sure that you're putting in that document the type of disease and why the patient should not go on that specific medication that the insurance company is recommending, and why you and the patient would prefer the patient to be on this medication. As much medical information and medical documentation that you can include, the better. And clerical errors or omissions can result in denial. If the insurer claims that the exception does not meet the criteria, file a complaint with the State Department of Insurance. States need complaints in order to ensure the law is properly implemented. The Foundation is very interested in hearing from you regarding these reform laws, if the process is working, if it's not working, if it's helpful for your patients. Please share your thoughts at advocacy@crohnscolitisfoundation.org. Still being denied. So if the denial was due to patient not being on an eligible plan, or if all appeals have been exhausted, please contact the Help Center and visit our page on the Managing of Cost of IBD. You can contact the Help Center at info@crohnscolitisfoundation.org, or you can call us at 1-888-MY-GUT-PAIN or 1-888-694-8872, extension 8. Making a plan of action with your patient is very important. So help your patient understand the process and rights afforded to them with step therapy reform law. Make sure you and your patient are on the same page and you're communicating throughout the process, because patients may get a letter in the mail saying that they've been denied the medication, you want to make sure that they're aware that they were denied, but that you're working on that appeal process on behalf of them. Keep them informed throughout the process is extremely important and will make sure that your patient is more satisfied. Providers play really an active role throughout this process because we are the ones that will need to submit the letters of medical necessity and make sure that the proper documentation is submitted by your office. There are other ways to get involved. So half the states in the country have state step therapy reform laws, but that, as I said before, that only covers state regulated health insurance plans. It does not cover federally regulated health insurance plans. The Crohn's and Colitis Foundation and other organizations are working with the federal government to get the Safe Step Act passed, which would cover federally regulated health insurance plans. It would close that loophole for patients with insurance that are regulated by the federal government. So this would complement state legislation. It also has bipartisan support. Please get involved. Join our advocacy network at www.crohnsandcolitisfoundation.org/advocacy. Some other important links to take home with. You can go to the Crohn's and Colitis Step Therapy website. You can contact your State Department insurance company for more information. Please check out the Managing Cost of IBD website at the Crohn's and Colitis Foundation website and join our advocacy network. We'd like to thank UCB for their generous support and sponsorship. And we also like to thank our patients, providers, and professionals of the National Scientific Advisory Committee for their contribution on this educational